Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Ben Reinking. He is a pediatric cardiologist, medical educator, and certified physician development coach. Today's Kevin MD article is The Power of Emotional Intelligence, a personal story and lessons for physicians. Ben, welcome back to the show.
Thanks, Kevin. Always great to be here.
All right, so today let's jump right into your article about emotional intelligence. What's this one about?
This one's about a specific patient encounter where just a little minor miscommunication with the family or math error kind of resulted in an opportunity, one for a student to kind of intervene and have a chance to speak up. And then kind of our conversation with the family and kind of the events that unfolded just really was an episode or an event that just kind of stuck with me. It's been several years since it happened. And I think reflecting on why it was so important to me and why it stuck with me is it's just a great example of how relating to other people and responding to their emotions appropriately can just enhance inter-team dynamics and patient care.
All right, so tell us the story for those who didn't read your article.
Yeah. So I'd been on inpatient service and I was caring for a patient who, was born with a medical problem and he was several years into his course. And so he and his family had been through the medical system, and anyone who's been in the medical system for a long time is really informed about their care. And this family was really involved and were great advocates for their child. But he had been in the hospital for a really long period of time. And so we were working on just a nutrition plan to kind of get him the nutrition that he needed. And I think we calculated his fluids and nutrition goals. And I was like 5 cc's per kilo off on the calculation. And as I walked out of the room after a long conversation and sort of shared decision making with the family, the student kind of gently tapped me on there and said, Hey, Ben, hey, Dr. Ranking, I think you made a calculation error. And she was appropriately astute to notice that sometimes just those little kind of differences in care plans can really trigger families and kind of upset them. And so she was right. I made a minor calculation error, and immediately kind of my stomach dropped because I just dreaded walking back in the room after a long conversation, and the family had invested a lot in that. But we walked back in the room and I just said, hey, I made a math error. I'm sorry. And to my surprise, that just little admission really set off a memorable moment where the family just started laughing and kind of gave me a hard time about not being able to do math. And it was a chance. It's something that still now, almost a decade later, they bring up every time I see them that, hey, it's the doctor who can't do math. And it turned into a chance just to connect with them. And it turned into a really positive experience.
So, reflecting on your story, what immediate thoughts crossed your mind when that student pointed out your math error? And tell us, how did you use emotional intelligence to navigate that moment?
Yeah, great question. I think my first thought was just, dang it, like kind of just like that. Oh, nobody wants to make an error, no matter how minor it is. And so I think I had a little bit of guilt and frustration, and honestly a little bit of anxiety about just having to admit the error and go back in and talk to the family. At the same time, I was really thankful that the student said, hey, and just pointed it out, because it took something that could have turned into a big deal and helped turn it into something that was memorable. Yeah.
And then when you talk about emotional intelligence, what does that mean to you?
I think the core of emotional intelligence is really just recognizing what you're feeling. And so in that moment, it was really helpful for me to recognize, one, that I was frustrated with myself and anxious. And if I would have brought those feelings into the room, I think with the family, I think it would have turned out very differently. If I would have brought frustration in it myself, it could have been perceived as frustration with the family, which would have been very different. And so the core is really recognizing what you're feeling and then being able to sort of control those emotions a little bit and respond to them appropriately.
So, admitting a mistake, especially in front of a patient and their family, is never easy. Do you feel that strengthened eventually the bond that you had with that patient and family?
Oh, absolutely. Absolutely. I mean, I think one of the most powerful things that we can say as physicians is sometimes either I don't know, but let's figure it out together, or hey, I could be wrong, or I am wrong. Let's pivot and try something else. And that's one of the things that I think I've learned throughout my career is just the ability to use that shared decision making and make medicine a little bit more human. Just improves the experience for everybody.
So we talk about admitting mistakes, we talk about vulnerability. What are other examples of emotional intelligence that physicians and other health professionals can display during sometimes what is very stressful situations in the hospital or in the clinic?
Yeah, we're taught how to respond to the emotions of our patients and how to develop the strong physician-patient relationship, but it's not often that we learn how to respond to the emotions of our peers. And as you mentioned, working in hospitals is really stressful, and we are appropriately stressed and have a huge range of emotions in the workplace. And so I think another core part of emotional intelligence is recognizing the emotions of others. And that's really important to extend that to the people that you work with, whether it's other physicians or nurses or anyone from the front desk worker to, people working directly on your team. Because we all need to have a place to express and have our emotions safely. And sometimes we also need someone to help us reel it in when
Mhm.
things aren't going well. And so I think that's a really core part of leading a medical team as a physician.
And how about medical institutions themselves? Do they have a responsibility to foster the emotional intelligence of the medical staff? And if so, how can they do that?
Yeah, that's a great question. I do think they have a responsibility to sort of maybe to frame it a little differently to help allow us to work together as a team.
Hmm.
And one of the ways that we can work together as a team is just learning to relate to each other and to get through those difficult times. Nothing ever goes perfectly in life or in medicine, and we need to have the skill sets we need to navigate those challenging situations. Yeah.
So you're a physician coach. So when physicians talk to you and you want to coach emotional intelligence or you want to address that, take us into one of those coaching sessions that you would have, and how would you get that physician to develop that part of them?
The first step is really just helping people identify what they're feeling. And so we are taught, or maybe indirectly sometimes taught, that we need to kind of put our emotions aside in the middle of patient care. And
Yeah.
for those of us who have been doing it for a long time, I think that doesn't work very well. You can put them aside maybe for a short period of time, and then they creep up in other places. And so the first thing is just to name what you're feeling. And so that's usually the first thing I ask people to do is just throughout the day, when you notice a thought or a feeling kind of cross your mind, rather than discarding it, just try to name it throughout the day and do that for a couple of weeks. And it's surprising how much benefit that has. So I know when I first started that process, my emotional repertoire, so to speak, was pretty limited. I was happy, mad, sad, and
Hmm.
that was about all that I could name. And as I practiced doing that, I recognized that sometimes when I thought I was mad, really I was anxious, or really sometimes I was just tired, or sometimes I was frustrated. And so it's just kind of noticing those nuances really kind of helps people to navigate the healthcare system better.
And do you feel that's difficult for some physicians to do, or not just some physicians, a majority of physicians to do? Because during medical training, a lot of that emotional IQ, that emotional intelligence is stamped out of them during the course of the medical journey.
Yeah, it's really hard. I mean, it's hard to undo that programming. We spend so long learning how to work in the healthcare system, and it turns out kind of how we're taught to work, I think, isn't sustainable, and it's hard to undo that programming. Yeah, it takes time and practice.
Give us a sense of how long that takes in your experience talking to some of your clients.
If I'm being honest, I think it's a lifelong journey, to be quite honest. So probably over a period of months, you can develop that skill set where you can recognize your own emotions. But then the challenge is, all right, this is what I'm feeling. Now, how do I deal with that? And then how do I appropriately respond to what the people around me are feeling? And it's just a lifelong learning process, which honestly is one of the great things. I think it's what keeps medicine and healthcare interesting. And it's one of the great things about coaching is you can watch people grow and learn new skills, and it sort of changes your perspective a little bit.
So I want to go back to that story that you told. For those younger physicians, residents, and medical students who may be listening to you now, talk about the impact that had on you. Like it's a pretty powerful teaching moment, right? In terms of the impact it had on the family, the impact that it had on the relationship you had with the patient, and of course the impact that it had on a student who pointed out that error. So just reinforce again in terms of this whole story about how you use that as a teaching moment and how that has changed you as a physician.
Yeah, yeah. I think one of the most important parts of the story, actually, which I didn't touch on, is just the student's ability to just speak up and say, hey, I think that maybe you made an error. And what I appreciated about it is that she did it sort of in a really self-deprecating way, kind of just gently touched me on the arm and said, hey, I'm not sure if I'm doing this right, but I don't think the math was right. And so always having the ability to just speak up and feel like what you say matters is important. And that's a skill in and of itself. But as people in the teaching position or the attending position, giving people the space to do that and allowing them to speak up is really important. And so for me, those are really the two, from a team perspective, the two most important moments of the story. Yeah.
And it's a credit to you that the student had the confidence and the space to point out your error. And I think fostering that environment is tremendously important. So, as attending physicians, like what are some of the things that you do that allows medical students, interns, and residents to speak up whenever they see something that is inaccurate, despite where they are on the traditional medical hierarchy?
One thing that I try to do is I end every patient encounter when there's a student or resident in the room is, usually I'll end the encounter and then I usually turn to the resident or student or whoever I'm working with is, hey, did I forget anything? Or is there anything else that you want to add? And so giving them the opportunity to speak up in front of the family, I think is really powerful because it places them in a position of authority sort of from the family's perspective, but then also gives them the floor. And then that just creates a culture, I think, where they can speak up in other places as well.
Absolutely. The empowerment, giving them some
Mhm.
stakes, I think is tremendously helpful from an educational standpoint and a confidence standpoint as well.
Absolutely.
We're talking to Ben Reinking. He is a pediatric cardiologist, medical educator, and certified physician development coach. Today's KevinMD article is The Power of Emotional Intelligence, a personal story and lessons for physicians. Ben, as always, let's end with some take-home messages that you want to leave with the KevinMD audience.
Yeah, I think I'll just go back to that coaching exercise I talked about before. If you want to learn a little bit more about emotional intelligence, just spend the next couple of days trying to name what it is you're feeling throughout the day. And I think you'll be surprised by how much you gain from it.
Ben, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Yeah, thanks, Kevin.